Thank you for joining Continuous Learning with Bioguard. It is my pleasure to introduce our webinar speaker, Dr. Chen-Si. Dr. Lin got her DVN degree from National Taiwan University and her PhD from College of Biological Science and Technology, National Jiao Tong University. She's a professor in the Department of Veterinary Medicine and director of Zoonosis Research Center at National Taiwan University. In addition, she is a former director of the Animal Disease Diagnostic Center at National Taiwan University. Her specialties include veterinary clinical microbiology, clinical pathology, and animal cancer biology and therapeutic development. Electrolyte balance is crucial in veterinary pathology, supporting cellular function, fluid homeostasis, and overall health of animals. Key electrolytes like sodium, potassium, calcium, and chloride regulate osmotic balance, acid-base stability, and neuromuscular function. Imbalances can cause dehydration, renal issue, and metabolic disorder, making accurate measurements essential for diagnosis and treatment. In today's lecture, Dr. Lin will walk us through the complexities of electrolyte equilibrium. We are thrilled to have her as our speaker for this webinar. Without further ado, please join me in welcoming Dr. Lin.
Hi, good evening, everyone. I'm Chen-Si from National Taiwan University. It's my pleasure to be here and to share with all of you with the topic regarding electrolyte, how to the result, the consequences of electrolyte imbalance and the potential outcome, and how to adjust to make this electrolyte balance to follow how to adjust this electrolyte to become to make all of them to become balanced. And if this electrolyte imbalance occurs, the animals may suffer from what kind of the symptom and the causes. Today we will all mention, and this is the main topic that we will mention tonight. Okay. So I'd like to, and I appreciate the support of the webinar tonight. So if you are interested for how to monitor the electrolyte, maybe you can check the follow the Bioguard in Facebook or LinkedIn using this QR code. So what is electrolyte imbalance? Actually, this electrolyte is the essential minerals within our body fluid. So when this the role of this electrolyte actually they play is try to maintain the fluid balance, because the electrolyte exists within body fluid. Actually, they will they provide the basic normal osmolarity within our body fluid. This body fluid contains blood, contains the extracellular as well as intracellular fluid. So it's very important to maintain the osmolarity in each compartment. So body fluid balance is important and maintained by this electrolyte. And also these electrolytes, they responsible for the normal function of our nerve and the muscles. Especially in this case, I think potassium and calcium and the magnesium, they're important for the normal nerve stimulation transmission, and they will maintain the normal muscle function, how to make this muscle to contract normally. Also, these electrolytes, they are important to regulate the normal pH values within the bodies, both in human beings and both in animals. Later, we will also introduce that the imbalance of this electrolytes may result in such as if imbalance occurs, it will result in acidosis or alkalosis. So this minerals, so this electrolytes, and they need to be maintained in the normal range. If the imbalance occurs, we can see some specific clinical symptoms, and we need to adjust them. Or if we cannot adjust them at the right time, the possible outcome may be severe and maybe fatal. So how to maintain this electrolyte balance is important. So we've already mentioned that this electrolyte is essential for cellular functions, such as for the nerve system. This electrolytes, they mediate impulse transmission and they conduct the nerve impulse transmission, and they maintain the muscle contraction. So it's important for this to monitor this electrolyte within the normal range, or if the cases they show some symptoms regarding with the nerve, regarding with muscle contraction, or regarding with some heart functions, you need to, it is possible that for us to monitor if their minerals or electrolyte level within blood is, if they are maintained in the normal range. And this minerals, they maintain the fluid balance, they regulate pH values that what we call in previously, if the normal function, normal range is not well maintained, the animals may suffer from acidosis or alkalosis. So it is important. And this balance is also actually they play the important role because they are significant to maintain the kidney function, the heart function, and as well as the digestive system. So later we will also introduce them. So actually, this electrolytes such as sodium, such as potassium, such as calcium, they are important to they're important in kidney, heart, and digestive system. These three basic organ or systems are important. And so such if these three organs, their functions are influenced by this electrolyte, the outcome actually is the outcome will not. We need to rebalance them, or the outcome will be a little bit. The outcome will be bad. The prognosis will be bad. So, in addition to these organs, these electrolytes, they will also related to the immune systems. Because, for example, magnesium is the coenzymes for all biochemical reactions within cells. So it will also potentially influence the immune system as well as the energy metabolism. So we can understand that this balance actually it has the systemic influence, not just by some specific organ. It will influence the overall physical function of the animals. So the first common electrolyte imbalance we want to introduce is the regarding with the imbalance of sodium and potassium. So frequently we can find in clinical side will be hyponatremia or hypernatremia. Regarding for hyponatremia or hypernatremia, it means the for hyponatremia, it means the blood concentration, sodium concentration within blood is lower than the reference range. And what reasons will result in hyponatremia? Actually, most of cases, it's result from excessive water intake or kidney dysfunction. So if the animal are suffer from they overtake too much water, or they have some problems of the kidney, we may find hyponatremia. It means the lower sodium concentration within blood. So that's what we need to to take care the first. In very, very few cases, some mild dehydration, we may also observe the hyponatremia, but it's only in rare cases. And for hypernatremia, so on the contrary, for hypernatremia, it means the high sodium concentration within blood. So sometimes, most of cases, dehydration, because the water within blood is decreased, is severely decreased. So it result in the concentrated blood. So it will result in the hypernatremia. And also, if the animal they are under the condition of excessive sodium intake, maybe via diet or maybe via some drugs, it will also result in hyponatremia. And also the kidney problem will result in this same situation. So for the electrolyte balance or imbalance, the kidney play the important role for maintaining the if this electrolyte they are within their normal range or not. So in this case, we can see either hyponatremia or hypernatremia, and they both can result from the abnormal function of kidney. So for the potassium, we can basically we can find the condition will be the animal may suffer from hypokalemia. That means the lower potassium concentration in the blood, or hyperkalemia on the contrary. So hypokalemia indicates the lower potassium level in the blood, and the imbalance can be caused by, maybe inadequate the deficiency potassium intake, kidney problem, and some certain medications. So we need to know from the owners that if this animal, they are currently under some kind of treatment and some specific drug treatment will result in hypokalemia. And for the hyperkalemia, on the contrary, again, the kidney played an important role. For the patient, if the patient is suffer from kidney failure or some medications, or they are overtake the potassium via diet or via some supplements, or under some specific treatment, it may show that the hyperkalemia for these cases. Okay. So as we mentioned, that this electrolyte imbalance, basically from the previous slide, we've overlooked the hyponatremia, hypernatremia, as well as the hypo and the hyperkalemia. And we can find the common point of them is kidney. So actually kidney dysfunction is, if the kidney, most of the kidney normal function are lost, and it will result in very severe electrolyte imbalance. So it's very important to, on the first step, after we know the history of this patient, and then we need to do some examination to monitor, to know if the kidney work well or not. So it's very important for kidney. But if it's not the result from kidney problem, actually there are two main reasons that will result in this mineral or electrolyte imbalance. The common cause of electrolyte imbalance is fluid loss, such as dehydration. So what conditions will cause dehydration? Basically, most of the time we can see if the animal, they are suffer from diarrhea, they are suffer from severe vomiting, or now this is a human case. In dog, not sweating, they usually don't sweating. So in dogs and cats, actually the dehydration will most result from diarrhea, severe diarrhea or vomiting. So this severe diarrhea and the vomiting, they will cause the loss of body fluid. And within this body fluid, this electrolyte, sodium and chloride, and this electrolytes, they will lose. Or sodium bicarbonate ion 2, they will be lost with the body fluid by severe diarrhea and vomiting. And another issue we need to know is the because this electrolyte, actually the balance of these minerals, they are maintained by some specific hormones. So we need to know if the hormones are in their normal range or not. So we can see there are two main hormones. They are in charge of the electrolyte balance management. So the first one is aldosterone. Aldosterone is try to they work on the kidney and to try to let the kidney actually to retract the sodium and the chloride to reabsorb within the body. So aldosterone actually is try to maintain the normal range of sodium and the chloride. So it is very important hormones to regarding for the sodium and chloride as well as potassium actually. Another hormone is parathyroid hormone. They also play an important role for maintaining the homeostasis of these electrolytes. And for the medications that we need to know is that some cases we can find the abnormal expression, abnormal the phenomena of this electrolyte imbalance. We need to know if this case suffer from other kind of treatment, if they take specific medications and to result in the imbalance. For example, if the case, actually the some corticosteroids with the short-term effects, this kind of corticosteroids will result in the trap of sodium within our body. So that means if this animal they are under the treatment of this short-term effect corticosteroids, it may show hypernatremia symptoms we found. So in the electrolyte imbalance will show some typical clinical symptoms. So these symptoms, they may not, we can see this clinical side actually, but this clinical side actually is not very specific, refer to some specific organs. We just can find them. For example, these common symptoms will including to the lesser, the profile, you can see the animal, they become not so, they may be feel some fatigue thing or weakness, and some cases you may see that you can see the animals, they don't they become tired, and also some altered mental status. In some severe cases, this imbalance will result in seizures, the tremors of the muscle, and most severe case, it may result in cardiac arrhythmia. So these symptoms, if they show these symptoms, we need to, next stage, we need to check. We need to do blood drawing and to monitor the specific, we need to monitor the different kind of electrolyte. They may include the sodium, the potassium, the chloride, and calcium. And then to find out what kind of the electrolyte problem occurs and to result in the symptoms. So I want to take this one by one, so you can see the this imbalance will result in specific clinical symptoms. So basically, if the animal they suffer from some weakness, it's very important. Not on both hypo and hyperkalemia, they will result in muscle weakness. But for hyperkalemia and muscle weakness is just the starting symptoms. If we don't manage this situation at the right time, then the animals may show paralysis, and the severe cases will be cardiac arrhythmia. Again, for the calcium, this is another electrolyte, calcium. Actually, free from calcium is usually low within blood. because most of the calcium actually are within our bone. So they are stored within bone. So the free form calcium actually they are low. However, this low concentration of calcium, they are also important to maintain the homeostasis of muscle. So in hypocalcemia cases, the patient will show the typical symptom will be the muscle cramps, tetany, and also seizures. So it's important. In that case, it will be magnesium. So for the magnesium, as we mentioned before, it's important because magnesium, they play the important role in maintain normal physical function of our cells because it's the and one of the important functions is the coenzyme of our cells. So we can see either hypo or hyper magnesium within the blood will result in muscle weakness and tremors and in some severe case seizures. And for the hypermagnesium cases, in severe condition, it will repress the respiratory functions. So that would be fatal to the animals. So how to diagnose this electrolyte imbalance? We have the 3 stages. So I think maybe all of you are familiar or you already to do this 3 stage check. So the first stage is that we need to know the case history. We need to do some physical examination. We need to collect all these informations about the animal symptoms, about their medical history, and what kind of diet. Because both medical history and both the diet or the supplements they use may cause this electrolyte imbalance. So first stage, we need to do all this, we need to collect all this information. And the second stage, what we will do is the laboratory testing. We need to analyze the blood as well as the urine because we've already know that the kidney played important role to regulate this electrolytes concentration within our body, within our blood, within our body fluid. So both blood and urine are important. They need to be analyzed to measure the electrolyte levels and to monitor the kidney function. So it's important. And the third stage that what we can do, the third tool that we can have is the imaging test, imaging and screening. Then we can use X-ray, we can do radiography, we can use the ultrasound and other imaging techniques that can help us to find out if the specific organ, if some potential problems are happening in specific organs. For example, we can monitor the kidney, the morphology or something bad appears within the kidney or within the thyroid systems. So also, so this image techniques are also suggested to help us find out what's the problem result in this electrolyte imbalance. So basically, the first after collected the basic information of this animal patient, next stage we will do some blood or urine analysis. So we can use different kind of blood analyzer. For example, here the Bioguard, they provide the analyzer as well as the specific reagents to help us to not just only to monitor the electrolyte, we can also to analyze different, we can use different parameters such as the parameters of kidney, BUN, creatinine, and so on to help us find out the specific, if any specific problem occurs. So here is the different kind of panel that we can use for this blood biochemistry parameters and to help us find out the problem occurred. So we will mention about this electrolyte. Actually, they are important in to maintain the they are important in our body fluid to maintain the normal osmolarity. For example, actually, sodium is basically well, they are basically distributed within the extracellular fluid, such as plasma. And for the potassium, actually, they are mainly exist within the cell. It's the main electrolyte within the cell in the intracellular fluid. So different kind of electrolyte, they are distributed in different compartments of the body. So they are responsible for maintain the osmolarity of the of our cell. So that's why we need to monitor. We need to each of them to maintain these some specific normal range. If they do not, it will cause that's the clinical symptoms what we mentioned in the previous slide. And another role that this electrolyte played is they are important to maintain the acid-base homeostasis. So that means this electrolyte, they are important in maintain the pH value within our body. So this electrolyte-based system, a balance system, they are maintained by some buffer system. So they are responsible for some buffer system to maintain the acid-base balance. So such as bicarbonate and the phosphate. Bicarbonate and phosphate, they are also the important electrolyte within our body. Bicarbonate is responsible for the extracellular body fluid balance, acid-base balance, and phosphate, they are important in maintain the intracellular fluid acid-base balance. So it's actually this electrolyte, especially in this case, bicarbonate and phosphate, they are important buffer system to maintain the body fluid within the normal pH values. And for the normal pH value maintenance, except for the bicarbonate and phosphate, these two kinds of electrolytes, we also rely on lung, the respiratory system, and kidney, the renal system. We also mainly highly rely on these two organs to help us regulate acid-base balance, because we've mentioned about that actually kidney is the main organ that will help us to trap the electrolyte or secrete out the electrolyte to help us to maintain the balance of the electrolyte. Such as we mentioned about the aldosterone, because aldosterone, they work on the kidney tubular epithelial cells to reabsorb sodium and the chloride. At the meantime, aldosterone also work on the tubular epithelium cells to secrete out the potassium. So basically, most of our electrolyte balance is regulated through the workload of the kidney. So for the lung, for the respiratory system, basically it will, because we will mention about that bicarbonate is the important buffer, and so this part, actually the lung, we're regarding for the bicarbonate balance, and then to maintain the balance in the balance of acid and base. So if electrolyte imbalance occurs, the consequence will also to result in imbalance of acid base. So if the acid base imbalance occurs, it will lead into acidosis and or alkalosis. So for this an acid base balance maintain, the most important thing is one of the most important thing is related to is resulted from the electrolyte homeostasis. So just as we mentioned before, there are four aspects we need to focus on to maintain this acid base balance as well as electrolyte balance. So the first one is hormone regulation. So we mentioned that the aldosterone, they are responsible for the sodium. They are responsible for the chloride retrap, and they are responsible for the potassium excretion and in kidney. And also ADH. ADH is also the hormone, but this hormone, they are also work on the tubular epithelium cells of the kidney, but they mainly responsible for the water reabsorbed by kidney, as well as the parathyroid hormone. And this three hormone is the mainly hormones that are responsible for the electrolyte and water homeostasis. So this is important to regarding for the to monitor these hormones if they are within the normal range or not. And also the renal, the kidney functions. The kidney, they are important to filtering the waste and to regulate the electrolyte concentration. So if some situation are related to, if we do some blood test and we find that the electrolyte imbalance, the next stage is we need to go back to check if this animal, they are suffer from some kidney problem. So kidney, and another is the GI system. Because the digestive system, they absorb the electrolyte from food or from some beverages. So kidney functions we need to monitor. Another one is the GI system, the digestive system that we need to look at to see if they are some problem occurs on the GI system. Okay. So basically, it's this hormone, kidney function, and the GI absorptions. So this we already mentioned in the previous slide, but right now we will focus on the management. If the case suffer from hyponatremia, what we're gonna do is first we need to address the underlying causes. So we've already mentioned that the kidney, that GI problems or hormone imbalance. Basically, this is three. These are three major reasons that result in the imbalance of the electrolytes. So we need to address the problem. And then we need to do some following treatment, such as fluid therapy, such as dietary adjustments and the medications to reverse this situation. So again, on the contrary, hypernatremia. For the hypernatremia cases, how to manage them will, again, fluid therapy. So we need to know the overall, the comprehensive profile of this electrolyte. We need to know if they lack some specific electrolyte, or if they some specific electrolyte are already higher than the normal range, and then we need to do the tailored fluid therapy to make the animal go back to the healthy condition. So always fluid therapy, but we need to know the condition, and we need to adjust. We need to make specific fluid therapy. And also for the hypernatremia cases, we can use the diuretics. We need to do some dietary sodium restriction to help the animal come back to recover from the hypernatremia condition. So for the potassium aspect, if the animal are suffer from hypokalemia, what we can do is the fluid. We can maybe we can do oral or fluid therapy to make the animal, to help the animal recover from hypokalemia situation. So for the hyperkalemia treatment, it's again, we need to use some specific medication and some fluid therapy, and also dietary modification, just like we mentioned in hypernatremia cases. We need to do some dietary modify or restriction to help the animals recover from hyperkalemia. So for the if the case suffer from hypocalcemia, that means the calcium level within the blood are lower than the normal range, and then we can find some specific condition that maybe it will result. The basically clinical syndrome we already mentioned before, that is the muscle. We can see the muscle, maybe the muscle weakness, maybe the tremor. Also, sometimes in severe cases, we can see the seizure occurs in these cases. And because parathyroid hormone is important and regulate blood calcium level, so we also need to monitor if the PTH, the parathyroid hormone, is normal or not. So basically, the clinical signs of hypocalcemia will be such as muscle tremors and seizures, and weakness, muscle weakness. So in these cases, we find the clinical signs. So we need to go back to check the calcium level as well as the PTH level. And for the hyperkalemia, on the contrary, we mentioned before, so we focus on fluid therapy, on how to adjust, how to recover help the animal recover from hyperkalemia. Again, there's always tailor-made fluid therapy, help them to go back to the normal range. So this another cases is we are focused on magnesium. So the magnesium would be hypo case and hyper case. In hypo case, So we can know that the cause of hypomagnesemia actually is a little bit complicated. It may be the dietary deficiency, maybe the malabsorption issues, that's what we call the GI problem. If the animals suffer from GI problem, the possible one of the possible outcome is we may see the hypomagnesemia shows, and also the kidney dysfunction, and or if the animal are under some kind of other treatment, and this treatment will result in the lower concentration of magnesium within blood. So we also need to do some fluid therapy to adjust the magnesium level of this animal. And actually, if the animal suffer from some specific or some specific electrolyte imbalance, the routine, regular monitoring is needed to see if our treatment is efficient or not, to adjust their imbalance. So on the contrary, for the hypermagnesemia, the management, in mild case, it may need, what we need to do is to restrict the magnesium intake and increasing fluid intake. So it's basic is the diet management. So try to reduce the uptake of magnesium, and also to try to help the animal to increase the water intake. This is in mild case. In severe cases, we may need some medications, such as calcium gluconate. Okay, it will help the animals to counteract the effects of excess magnesium. So again, during the treatment period, regular monitoring is needed. So we need to do the fluid therapy on each different kinds of electrolyte imbalance. What we need to do is we need to do this tailor-made the fluid therapy. We may need to use some electrolyte replacements. That means we need to adjust all this electrolyte to within their normal range. And the regular monitor and adjustment, including diet management, including specific medication, as needed. So this is what we do for manage this electrolyte imbalance. So what we need to do is the balanced diet is very important, and yes, so some specific diets are needed. And also hydration is important. We need to make sure the animals, they have adequate water intake, not too less and not too much. Just the normal water intake is also important. So fresh and clean water should always be available. So what we talked before, just as what we mentioned in the previous slide, that the kidney problem and GI system problems, they may result in the electrolyte balance. So such as for the GI problems, if the diarrhea, severe diarrhea and the vomiting occurs, it will result in electrolyte balance. Especially the potassium, the sodium, the chloride. The chloride, there were the GI problem, the diarrhea, vomiting, they result in this imbalance. And this imbalance actually, first cases, because diarrhea and vomiting, they will result in the loss, not only electrolyte, but also water. So it will, the first case we may see is the dehydration may occur on these animals. But if the animals, they are suffer from severe diarrhea without a proper treatment, and then it will soon become metabolic acidosis. So in this case, if actually it's dangerous and need to be treated, that need to be adjust this acidosis situation. And on the contrary, if the animal suffer from severe vomiting condition without the proper treatment, and these animals, okay, dehydration, we can see on this case. And on the contrary, if this vomiting is not well treated, then it may become metabolic alkalosis. So either metabolic acidosis or alkalosis, they are, and the outcome will not be good if these animals are not proper treated. So for the kidney problem, yeah, we mentioned before, kidney is important, as well as endocrine disorder. These two factors, they are important in regulate the balance of electrolytes. So if some electrolyte imbalance occurs, we need to check GI system, we need to check kidney, we need to check the hormone levels. And if the fourth cause that we just mentioned now is about the trauma and the surgery, because the trauma and the surgery may cause significant fluid and electrolyte loss. So if the animal are suffer from severe trauma, or we do some surgery on these animals, we need to monitor the electrolyte and the body fluid level, and to see, because this loss will contribute to hypokalemia, to result in hypotension and the electrolyte imbalance. So these four factors actually, they are the main contributors to result in electrolyte imbalance. So what are the complications of untreated electrolyte imbalance? So it mainly will result in the following four aspects. The first is organ dysfunction, because this electrolyte, they are important for the cellular functions. So we can see the main organs, they are affected by this untreated, this electrolyte imbalance would be kidney, would be heart, and the brain. So that's why we can see the typical clinical function will be we can see the animals, they feel tired, they are not energetic, and they may show the symptoms of seizures, things, because these kidney, heart, and brain, or cardiac arrhythmia, because kidney, heart, and brain are the main major organs affected by the electro. If we do not to make the electrolyte go back to the balance, it will result in this damage of these main organs, cardiac arrhythmia. So as well as muscle thing. For actually potassium, sodium, potassium, calcium, magnesium, they are important in to maintain the normal contraction and normal relaxation of muscle. So if this electrolyte imbalance occurs, it will result in muscle weakness. Also, nerve transmission. So that's why if this severe electrolyte imbalance occurs, it will result in the collapse of nerve impulse transmission. So we can see it will result in brain some damage of the brain, and leading to the confusion, seizures, and the coma. So how to prevent the occurrence of electrolyte imbalance? So regular monitoring is important, and we need to make sure the animals, they are in the adequate hydration condition. They need to take enough water, but not excessive water. So it's important. And also the diet, we need to know, we need to make sure that the animal, they have the balanced diet. So not because diet is important, just as we mentioned before. Some diet, if they contain too much sodium or potassium, it will also result in the imbalance of this kind of electrolyte. And we've mentioned that that hormone, such as aldosterone, PTH, and kidney and GI system, these factors, this important issue, they will result in the electrolyte balance. So find out the underlying condition to result in the electrolyte imbalance is important. So this is some case study, and you can look up. Basically, it's a canine metabolic acidosis, and this case is a dog, and he suffered from canine metabolic acidosis. And why this dog suffered from metabolic acidosis? Because it's continuing to having diarrhea. So just as I mentioned before, because the diarrhea continued, so it's dehydrated, as well as they lost the electrolyte. In this case, the main electrolyte responsible for the occurrence of acidosis is bicarbonate. So after continuing diarrhea without a proper treatment, this dog, Max, they are suffer from metabolic acidosis. That's because the severe diarrhea will result in the loss of water as well as bicarbonate. So what we need to do is to do some fluid treatment. And in this fluid treatment, because the loss of sodium bicarbonate, so we need to put in sodium bicarbonate within the IV fluid to fix the acidosis. And also we need to treat the diarrhea, so we use some antibiotics thing. So after the whole treatment, we can get the animal recover to his normal condition. So today we wanna share is about the actually the significance of electro imbalance, and we've also mentioned about the reason why this electrolyte imbalance occurs, and how to diagnose them and how to treat them. So then that's my topic today, and so thanks for your listening, and I'm happy to take any questions from you. Okay, so so I'm happy to discuss with all of you if you have any questions. Okay, I think the file will be provided by the Bioguard, right? Maybe later, Dr. Luo will provide the file, the PDF files for you. Okay. So here is a question is about regarding to how to diagnose metabolic and metabolic or respiratory acidosis or alkalosis. Okay, it's a very important question. So I think the first stage, what we need to know is about we need to know the concentration of the specific electrolyte. In this case, I think we need to know such as in the sodium. We need to know the we need to know the concentration of such as sodium and potassium, and then we can calculate by some specific, we can calculate an iron gap that you can maybe later you can look up what is an iron gap. An iron gap basically is consistent that we need to first address the concentration of the sodium, the concentration of bicarbonate, and then we can know the anion gap, and then we can understand if the animal are suffer from acidosis or alkalosis. So how to diagnose? The first step, the first step we need to know is the electrolyte concentration via biochemistry analyzer. And how to know is the acidosis or alkalosis resulted from metabolic and respiratory. Actually, it's another issue. If the animal are suffer from for example, they have some respiratory problems, so we then understand that this alkalosis and acidosis are respiratory ones. For metabolic cases, just as I mentioned, if the animal suffer from diarrhea, sting, so we can understand that his respiratory system is okay, but he has this severe diarrhea situation. Then in this case, that's what we call metabolic acidosis. So on the contrary, if the animal suffer from severe vomiting cases, because they keep vomiting, so they all the gastric juice of this animal are lost via the continuing severe vomiting. So in this case, the animals may suffer from metabolic alkalosis. So that's what we do to diagnose metabolic or respiratory alkalosis or acidosis. Okay, how can we calculate the total fluid loss? Okay, this is the So in this case, we need to know the concentration. We need to know the concentration of the specific electrolyte, if they are under normal range or not. And we need to know if this animal are dehydration or not. So if the animal are under the dehydration situation, then the next stage is we need to find a way to calculate the body fluid loss by some specific equations. But the first step we need to know is if their electrolyte is normal or not. Yeah, actually the treatments depends on different situations. So for the details, I mean, what I can provide here is about the general strategy, because each case they have each different problems. So for the case study I've provided here is the common case that we've seen in the clinical side for the diarrhea case. So for the diarrhea case, we need to find out what cause to have this animal suffer from diarrhea. So in this case, maybe the infection. So that's why we put in antibiotics together with fluid therapy. And so the general rule that what we will do is to adjust the electrolyte level within this animal. We need to make we need to make this animal go back to the electrolyte balance, homeostasis. So basically, fluid therapy is needed, but we need to know the deficiency, or we need to know which situation the animal suffer from. If they suffer from hyponatremia or hypernatremia thing, then we can put in water, we can adjust, we can put some specific electrolyte within the fluid therapy and to make them go back to the normal. So it's the general rule, but for the details, we need to see it because it's the case-by-case situation. Okay, there is a question about the how about the concentration? How about the imbalance of blood chloride? Actually, blood chloride is quite related to sodium. So chloride always follow with the trend of chloride, always follow with the trend of sodium. So if you found hyponatremia, usually you will also find hypochlorite in the blood. On the contrary, it will be the same situation. Okay, so I think thank you for all your questions. Okay, here's a very interesting question. If we face not only one specific electrolyte imbalance, if there are multiple electrolyte imbalance, what is the possible cause that we need to watch out? I think actually what I mentioned for the because I've mentioned that the chloride is always the trend of chloride is always parallel to the trend of sodium, and so basically, if you find hyponatremia, you can usually also find the hypochlorite within the blood. And what we mentioned before, the hormone level, the hormone type, such as ADH, actually it regulates sodium, it regulates chloride, it regulates potassium, the balance of these three kind of ions. So hormone imbalance, if we need to check if some hormone imbalance, especially ADH imbalance occurs. And also we need to watch out if the kidney problem, if the GI problem, because if kidney problem occurs, there will be multiple electrolyte imbalance we find. So typically, in most of cases, if a GI problem occurs, if kidney problem occurs, if hormone imbalance occurs, we usually see the multiple imbalance, multiple abnormality of electrolytes, not just only one. So it's very good questions. Actually, in the clinical site, we usually see the multiple abnormality of electrolyte instead of just one electrolyte. For the FIP case, I think I need to, because this is specific cases, so I think I need to, I need to prepare more information, and I think later maybe I can send the possible solution to Dr. Luo or to, and then he will send you back if you leave your email here. It's a very good question. Thank you. So thank you for you all for stay with me with our webinar, and thank you for all your questions. So I think I will leave the time and to hand out to go back to Dr. Luo.
Yeah, thank you, Dr. Lin, for the outstanding lecture today. And thank everyone for joining us. And we are looking forward to seeing you in our next webinar. And good night.